Welcome back, friends, to our Thrive and Alive Healing podcast. This is episode 105. This is part two of our, I don't know what we called the first one, to be honest, but our immune system response. Last episode, we were looking at acute and chronic infections and how those affect our health. Today, we're going to look at the immune system a little bit more specifically, kind of with a little bit more of a magnifying glass, but also I'm hoping to link in a lot of different variables of how stress affects our immune system. Okay. And how some of these, like the chronic and latent infections we were talking about, how those affect our health, how they affect physiological stress. Okay. So that's hopefully the groundwork of the things I'm going to try and cover today. So we've talked about in the past how stress, right, in general, emotional stress or physical stress can suppress our immune system. And the original thought was just that understanding is that stress increased levels of cortisol, or what we call glucocorticoids, suppresses our immune system. Okay. And that's why the pharmaceutical company manufactures steroids like prednisone, hydrocortisone, right? Because that suppresses our immune system and oftentimes decreases symptoms. So but our chronic emotional mental stress can also affect our immune system. So it's not just that the cortisol suppresses our immune system, but we're going to dive in a little bit deeper and introduce some different players within our immune system, something called our T helper cells. In the past, our podcast, we've talked about immune responses, especially around like viral infections, bacterial infections, even with the chronic and latent or acute infections. Oftentimes we've been talking about like the antibody antigen response, or like when we talked about food sensitivities way back in our episodes, we were talking about B cells. So that's the IgG, the IgE, things that maybe you guys have heard of. So we're going to dive in a little bit deeper and separate those out, sort of these T helper cells or these T cells from the B cells. Okay. I'm going to try to do this in a manner that makes sense. So last time we talked about our acquired or adaptive immune system versus our innate immune system. And that acquired adaptive immune system, that's those B cells. That's that library of signaling factors and viruses and bacteria that we've been exposed to. That's sort of that adaptive immunity, that B cell category. Okay. Now that component of our immune system is dictated, if you will, by something called TH2. And our innate immune system, what our immune cells are always looking for, trying to identify as something as self or not self, is that TH1. Okay, so the TH stands for T helper, whether it's a 1 or a 2. And normally, if our immune system is functioning optimally, there's a ratio between the TH1 and TH2 cells so that our immune system is balanced, if you will. Okay, so there's two different legs that I want you guys to understand that we're looking at a little bit closer. And each leg, the TH1 and the TH2, does different things. And so we can begin to correlate how stress affects those things. Okay. The TH1, like I said, is more associated with those B cells. So we know that increased cortisol can actually stimulate our TH2 cells. Okay. And so if we're increasing our TH2, we're increasing a lot of these, like they're called cytokines. They're signaling molecules, signaling chemicals that our cells release to stimulate different things. They can stimulate more cells to come to that area. They can stimulate other cells to differentiate into more specific antibodies. Mm-hmm. And so the TH2 is, if that is overreactive, okay, so the cortisol is upregulating our TH2. So if that is overactive, that creates a scenario where our immune system is unregulated unregulated. So that means there's nothing to kind of like slow it down, right? That's where we see things like allergies, right? Autoimmune conditions, eczema, asthma, even food sensitivities, because those are not regulated. They're just your immune system kind of going, off on its own and not being balanced like it's supposed to be, right? So if allergies are a new thing for folks, right? Like they've undergone a lot of stress and now they're experiencing a lot of allergies. We're looking at that root cause. We're looking at stress, but understanding that relationship between how cortisol actually increases our TH2, which increases that dysregulated immune system.
Okay.
Does that make sense?
Yeah. So is it kind of like TH1 and TH2 are on a teeter-totter? Like when one goes up, then the other one is decreased, and then the other one goes up and the other one's decreased. Is that right?
Yes. Yep. That's a great way to describe it. When we're looking at that TH1 and TH2 ratio, we want them to be balanced. So yeah. Usually when one is up, the other one is down. They're inversely related is what we call that.
So what is TH1's like? Let me see how if I can ask this question. Like what is TH2's primary focus and what is TH1's primary focus? Because they don't do the same thing. You wouldn't need two different ones. Like, does one do like viruses, bacterial? One does like, can you like, what's?
Yes. So yes. First, the initial response, TH1 is primarily viruses. Okay. They're the ones who put out they're always on, if you will. That TH1 is always on. That is the natural killer cells, the macrophages, those cells in the immune system that are always on the hunt looking for something that shouldn't be in our body.
Okay.
That's TH1.
Okay.
And it works with TH2 because normally if it sees something that shouldn't be there, it starts like apoptosis or cellular death. And then it does signal to TH2 to say, hey, come send your B cells so you can start categorizing and creating a larger immune response to put in the library. Okay.
Okay.
So TH2, if I had to put a broad category, TH2 is a little bit more bacterial and the secondary phase of a reaction to something foreign, something that's not supposed to be in our body, right? A virus, a bacteria, a parasite. Okay. But TH1 is primarily viruses because it's what we call intracellular. So TH1 is not, it's looking for things that have infected our cells that shouldn't be there.
Okay. So I'm going to try to conceptualize this. We're on a teeter-totter.
Yeah.
Right. And if people like me, I have a lot of allergies.
Yes.
So cortisol's ramped up, which has pushed my teeter-totter T2 up.
T2, yeah.
Suppress, like down regulating or something. I don't know the right word you want to use.
That's it.
For my TH1. So kind of handicapped my body a little bit to fight viruses because I've down regulated TH1 so much and my TH2 is constantly being pushing that teeter-totter up on that side. So my body can't fight viruses as well as it should be able to. Is that accurate?
That's accurate.
And that's why this is kind of a problem why we're talking about it, is because we want to be able to balance those back out. So my body has a fighting chance. Our bodies, I can just use me as an example, right?
Yeah.
Has a fighting chance to have T1 be able to go in and do its job against the viruses.
Yes.
Okay.
So I also want to make sure that I say that. So I started off with stress, affects TH2 and TH1, but it goes both ways. It's not just one-sided. So you're exactly right. So if TH2 is upregulated, then TH1 is usually downregulated. And TH1 is what we consider pro-inflammatory. So when we get sick, right, you think of like you get an upper respiratory infection and you get a lot of like phlegm and a lot of snot, right, and like a lot of coughing. Those are usually not always the bacteria or the virus. That's often an inflammation response because your body is trying to protect the tissues, but in a way like that mucus slows down the spread of that virus, right? So if it gets caught up in your upper respiratory, it's less likely it's going to go into your lungs because you have all that excess phlegm. Mm-hmm. The trouble is we don't like that excess phlegm, right? You don't want to go through a whole tissue box in a day when you're sick. Mm-hmm. That's not fun, but that's your body's natural reaction. So we call the TH1 leg pro-inflammatory because it's kicking out those cytokines that are trying to kill the infection, but also kind of protect your body at the same time. Yeah. So that fever, that inflammation, those body aches you get when you're sick, that's all a TH1 response. That's all normal to kill that infection.
Okay. So then does your body, I'm going to assume it does, but I just need confirmation from you. So our body in theory then could raise our cortisol levels. Like, hey, we need some TH2 going on. So we're going to raise cortisol levels. Or it can say, no, we need some TH1. So then it decreases our cortisol levels to get some TH1. Yeah.
Yes. Yeah. That's the goal, right? Is that your body's in that homeostasis so that it can respond to things like it's supposed to. So if our TH1 is suppressed, you're exactly right. That increases our risk for our susceptibility to viral infections, right? So viral infections, systemic inflammation. Okay, so if we have a high cortisol levels and it's suppressing that TH1, then we're having more sort of this systemic inflammation. We don't have that TH2 to bring that down. But also it can increase our risk for cancers because our TH1, one of the cytokines is, well, two of them, but one is called TNF, tumor necrosis factor, and then one is also our natural killer cells. And the role of the TNF, the tumor necrosis factor, it's targeting tumor cells. It's looking in your body for tumor cells all the time. And same thing with the natural killer cells. So if that activity is downregulated or suppressed to a certain degree, that also, can cause an increased risk for cancers in the future if we have chronic lowered TH1.
Right. There's just not as many cells because cancer is cells that have mutated or not healthy that our body naturally clears. And if TH1 isn't available in a normal level, then it's not able to clear it as
exactly
in the quantity we need it to keep us
healthy.
Yeah,
exactly. Yeah. And so I want to reiterate that, yes. So usually, and I don't know, I think a lot of people have kind of experienced this. So well, oftentimes when we're stressed, right, like we have a lot of things going on, you see this in college kids right around finals. This used to happen to us all the time. You're really stressed, and inevitably there's a lot more people who are sick. And they've done studies to identify the variables, if it's because oftentimes, finals can be like in the winter time. So is it because there's more viral particles, in the area? But they also find this in the summertime in May, that when finals and students are under a lot of stress, it still increases the risk of, infections and being sick.
Yeah, because your cortisol's up, so your TH1 is suppressed-ish.
Exactly.
Okay.
So when I have folks who come in and say, you know what, I get sick at this, the same time every year. I get sick the same time every year, whether it's like the spring or the winter or whatever. And I'm always like, okay, let's evaluate what's happening around that time. Like, why is your immune system not responding like it's supposed to? If it's around, oh, well, I get sick every spring after our family reunion because organizing it's really stressful. Okay, now we've got the culprit. Let's address that to help, get this balance, that teeter-totter under control so your body can fight off if it's exposed to something like it's supposed to.
Cool.
Does that make sense? Yes, yeah. But when I say to folks, or, we've talked about this, if we're experiencing a physical stressor, right, like that chronic latent infections, that again, like I said, it can go both ways. That's part of that homeostasis. So that can affect our cortisol and increase our cortisol levels, which will then act on our TH2 leg of the immune system.
Okay, hold on. Here's something, and I know that for you it's like normal, and my brain was like, wait, what?
No, that's okay.
So stress is either mental, emotional stress, physical stress, like working out, doing physically hard things. Yes. And then also like latent chronic infections is a stressor on our body too.
Yes.
Okay, I didn't realize that.
Yes. So just like the cortisol can influence our TH1 and TH2, our TH1 can influence our cortisol, which then can influence our TH2. So for an example, say somebody has a chronic infection like Lyme disease, okay? That can would be a TH1 reaction. So if our TH1 was high, then that can stimulate our cortisol, okay, which will actually do the opposite and can actually decrease our TH2.
Yeah.
Okay. So then that makes us less available to fight against like bacterial infections like strep throat, things we've already seen before.
Yep.
Yeah. So that it leads to the possibility of increased co-infections if we have a chronic latent infection that's kicking up a lot of cortisol and suppressing our TH2 or our B cell line.
Okay. So would it be then, so if we keep it in the category of stress?
Yes, stress.
Okay. If you also, because this is what I'm wondering, it's very interesting because I have a Garmin now that like gives you lots of data. And so there's always like, I struggle with having high stress scores, even though physically I'm not really stressed a lot, and mentally and emotionally, I don't feel stressed. So I'm confused why it keeps telling me I'm stressed. So this could be the other factor, because maybe it elevates my heart rate or my breathing pattern is latent chronic infection could be the other factor that's causing this stress reading.
Yes. So if it's not, if it's not, that's why we're always looking, right? Like, is there some physical stressor in your body that's kicking up that cortisol, right? I mean, the Garmin technology uses like heart rate variability, right? Yeah. And so if you're trying to fight off an infection, and if it's a low level chronic latent infection, you may not always get like the fever, the body aches, right? Like like feeling inflamed because it's not at high enough levels, if you will, right? So it's sort of this like under the radar type of scenario going on. And so, yes, that could be contributing to your higher stress scores.
That's why my HRV numbers are always crap.
Probably if we've accounted for the other variables, which I believe we have, and you have, that we're getting closer to the root cause of what's going on and what's contributing to our picture of health.
Do you know how, like, I mean, I don't know, my mind's blown right now, like how valuable and like mind-blowing this information is? Because like how many of us athletes, like, it's just like, oh, well, I guess I just don't work out hard enough. I guess I'm just not in good enough shape. That's why my HRV is not very good.
Yeah, that's not necessarily the case. I mean, we know for somebody who is maybe not as athletic, right, and who's like working on being more exercise resistant, is that, you know, if you're as your body as you get more in shape, as you're more toned, right? Yes, that does affect your heart rate variability, those HRV scores, even your body stress scores. But if you're pretty fit and an athletic person, and those scores are off, you've got to start looking at what other physical stressors. It may not be a workout, but it can be, chronic infections that are, like I said, kind of going underneath the radar, and your body is keeping them at bay for the most part, but your body's always working. And so even though you may not feel it, it may not be like physical exercise or strenuous work, that cellular system is still always working for you. And so, that's going to increase your HRV scores.
Okay, sorry, that was a tangent for Kim.
That's okay. There may be other folks who are in a similar boat who are like, oh, that's why when we talk about stress, when we talk about, people who are feeling kind of, it's not even always just fatigue anymore, but you just don't quite feel 100%. Because I have more folks who say, I've got energy, like I get through the day. It's not like I can't get out of bed or get off the couch, but I just don't quite feel 100%, right? It's like, okay, let's peel some more layers off and figure out, what is contributing to that stress, if it's mental, emotional, if it's physical stress. And so understanding that relationship, I think, is very important.
Yeah.
Cool. Does that make sense?
Yes. Sorry. I'll let you go back to your.
No, that's okay. That's all right. That's perfect. Because I mean, hopefully, that makes a little bit more, more sense for folks. So this role between that TH2 and that TH1 is so important. So not just, how our mental emotional stress affects our physical health, but even how it can set things up. So let me give you an example. And this is a little bit of an extreme example, if you will, but if we undergo a lot of chronic stress, okay, and that suppresses your TH1 for long term, for years, let's say, maybe a lifetime for some folks, and then somebody gets cancer, okay, because of that suppressed TH1. And some of the naturopathic oncology field work, or their approach to treatment, is trying to balance this TH1, TH2 teeter-totter, okay? Because if they can balance that TH1, TH2 teeter-totter and address that physical stress, then we can recruit your TH1, that TNF, that tumor necrosis factor, those natural killer cells, to work with your body, right, to target tumor cells and shrink tumors and shrink cancer cells, right? Usually they're doing that alongside other therapies that will also shrink those cells. But from our perspective, we're always trying to find ways to engage the body, right? Like where was the weakest link, or where was that disconnect that our body wasn't able to do what it's supposed to prevent, things from getting out of hand, right? Like from those chronic infections, from those cancers and things like that. Okay. Now, to tie this to last episode when we talked about chronic and latent infections. So in the past, I've said, if you have a robust immune system and you're exposed to something like mono, Epstein-Barr virus, if you're exposed to something like a tick-borne illness, if you're exposed to something like shingles, chickenpox, herpes, things in that family, oftentimes if we have a robust immune system, we can clear those infections. Right. This is where, if we don't have a robust immune system, this is what I mean. If our TH1 and our TH2 are out of balance, that opens up that opportunity for those infections to hide within our cells and become latent.
Oh, okay.
So then they can rear their head later on in life.
Okay.
Does that make sense? Do you see that connection?
I do. Yep.
Yes. So again, when our immune system is not robust, and it can be not robust for, different reasons, right? It could still be because we were under emotional stress, we were under physical stress. And that physical stress, again, so it could be infection. So we kind of get this cycle here, but it could be things like injuries, right? Like an accident where our body had a lot of injuries at once, whether we had surgery and our body was trying to repair a lot of things at once. That's a physical stressor. Even pregnancy and postpartum for folks. Strenuous exercise or strenuous, work are all physical stressors. And so even though some of those things can be situational, right? Like they may just be a short amount of time versus like pregnancies of 9 months, right? Or like maybe a recovery from an accident or a surgery may be 8 weeks, 12 weeks. So in the big picture, that's not a lot of time, but that time where your immune system's not robust, if there's exposure to other things, it kind of opens up that door.
Okay, question. What about little kids? Like that, that like little kids that don't have great immune systems, like they're 4, 5, 6 years old, they haven't been in accidents, they don't do CrossFit, right? Like, I don't feel like kids are, yes, in terrible, horrible situations where they're stressed, but like there's lots of little kids that kind of have a normal-ish childhood that still have like crappy immune systems.
Yes. So when we're looking at kids, I'm always looking at a couple of things. Depending on the age, I want to know what their labor and delivery looked like, right? Where did they have a C-section? Were they was mom having trouble with delivery? Like how long was she in labor? Because that is a physical stressor for babies, right? Like that kicks up. We've seen that if they draw blood on a baby and it's a stressful labor, then that baby's immune system is going to be under stress. If there was any trouble in that arena. The second is we got to look at gut health. Okay. With little kids, we have to look at gut health. So one of the physical stressors can be an imbalanced gut health. So it can kind of go both ways, and it kind of feeds another cycle because an imbalanced gut health where they don't have a lot of good beneficial probiotics that are contributing to our health and our immune system can create a lower TH2, which increase it. No, let's see.
Lower TH1.
No, lower TH1, higher TH2, which increases more of that IgE, IgG reactivity. Okay. So there's a relationship there. So usually in littles, I start there because you're right. Oftentimes they don't always have a lot of strenuous exercise, right? But they can still undergo, you think, babies are small, they can still undergo a lot of physical stress at birth, or if in the first 2 weeks they had a fever of unknown origin, that can be a really large physical stressor on babies. And sometimes, if they have like antibiotic use in that first 3 months, we look at that, right? If they're older, oftentimes ear infections are a really big deal for kids. Sometimes that's associated with their gut health, but if they get a lot of ear infections and those have been treated with antibiotics, those are physical stressors that create this imbalance of TH1, TH2. So that opens them up to, if your TH2 is high, opens them up to asthma, to allergies, to eczema, right? Because, or like, yeah, asthma, allergies, eczema, because that TH2 is very elevated.
Like strep. I notice
Yes.
you get strep a lot.
They get strep a lot. So normally if you get, like for kids, normally when they get strep, right, it's the same thing if we were to get strep, our B cells identify that and we should catalog it in that library, right? So then your strep infection should not be, your body should be able to take care of it quickly, right? So like if you do get exposed to strep, you might get that sore throat, but it may only last like 3 or 4 days, maybe 5 days, right? Okay. That first reaction will probably last 10 to 12, but after that, it should be a lot shorter. And so if our TH2 is out of balance, and we're not able to categorize that bacterial infection, then sometimes, yeah, you get kids who get strep every month, or kids who get strep and it, like they have to be out of school for a week. And so that's where we have to balance this TH1, balance this TH2 so that their body can respond to that. And we also have to figure out the source of the strep if we can, but so they can have a better immune response. And it doesn't, if you have any infection that occurs every month or regularly, something's wrong. We have to address that. That's not that's evidence of an imbalanced immune reaction. Yes. Yeah. So that was a great question. Yes. So kids are different but similar, right? Like they have the same mechanisms, the same immune response, just oftentimes their root cause or their triggers can be a little bit different.
Yeah. Yeah, that makes sense.
Yeah. And sometimes it's easier to identify in kids because they just haven't been on this earth as long. So they don't usually have as many complications, but right. Each child is different, but yeah, in general. So.
Yeah, cool. Thank you.
No problem. The other thing, so, TH2, also this is, I don't know, this is exciting to me. But so even though there's this teeter totter, right, this TH1, TH2, so TH2 that's often upregulated, it's, you know, in times of high stress, it actually secretes, the presence of TH2 secretes cytokine called IL-10, interleukin 10, which is a regulatory interleukin or a regulatory, the cytokine, the chemical signaling molecules. And so it can regulate itself, or it can downregulate TH1 if TH1 gets out of control. So it's one of the big factors that helps to balance out that teeter totter. The trouble is that it can get, when your body gets so much stimuli like cortisol, it can only balance out so much at a time. That's where that homeostasis comes in. But our body has natural fail-safes, if you will, to try to bring that TH1, TH2 back into balance. Just and it's constantly working to accomplish that. That's the desired state our immune system wants to be. That's what makes it optimal. And so that's why we have to address sort of all these other factors that are, you know, kicking it off in one direction or the other. Mm-hmm. So, but it has built-in fail-safes to keep itself balanced if we get out of the way. So, yeah.
Cool.
Perfect. I hope that makes sense. Yeah. Let's see if there was anything else I think that's most of the things that I wanted to explain today.
So what do people do? It's like, okay, I probably have imbalanced TH1, TH2. Like, what are my next steps? What do I do?
So the next steps are to try to identify if this is, so one, we have to tease out, because we're always looking for the root cause, right? We have to tease out for your particular situation, is this an emotional stressor that's, kicking this off out of balance? Is this a physical stressor? Okay, let's just divide those two out first. If it's an emotional stressor, work with our New Beginnings program. That is the easiest clear-cut way to help to address that, and work on your belief systems, your thoughts, your understanding of stress and how we have a tendency to create stress, or how we have that stress response to things external to us, right? Yeah. If it's a physical stressor, reach out to me. We've got to figure out what that is. If it is something that is like the chronic and latent infections that we talked about last time, and we suspect that, you can get testing for those. If you have an idea, if you're like, hey, you know what, I had mono when I was a kid, or I have, things like fibromyalgia, I have autoimmune conditions, and you have sort of that risk factors, sometimes we can address the body like preemptively without testing. But sometimes if we get the testing, then we can be a little bit more specific. Okay. Because oftentimes we have to address what type of infection it is, if it's viral, if it's bacterial, if it's a spirochete, and there are specific herbs that we can use to address those. And then things to, balance out the immune system. Minimally, what we can do to help optimize our immune system with food as medicine, mushrooms. Yeah. So if you're a fan of mushrooms, we've got to be increasing your mushrooms in our diet. I can't remember if I've talked about this on here before, but mushrooms have something called polysaccharides in them. And that helps to balance this TH1, TH2 piece of our immune system. The specific constituent in mushrooms is called beta glucans. And so you can find beta glucans in a supplement form. But even like the mushrooms we find in the grocery store, the white button mushrooms that they grow, the portobello or the baby bella mushrooms, have beta glucans in them. So increasing those in your diet like 3 to 4 times a week. You can also do things like mushroom powder as a seasoning on your food. The higher concentrations of beta glucan will be in things like the shiitake, the reishi, the maitake mushrooms. Now, I was looking to see if it was raining. This time of year, if we have any foragers out there, this time of year is a great time to forage for mushrooms. Do your research, do your homework, because we do have some mushrooms in Oklahoma that they're not good for you. We do have poisonous mushrooms. They're not as bad as the one in the Pacific Northwest where they will kill you when you eat them. But we do have some that can make you very sick and can put you in the hospital. So do your homework. There's a couple resources out there on foraging mushrooms in Oklahoma. If you Google that, you can find them. I think there's a big community on Facebook, and they do have get-togethers to, show, like, teach you chicken of the woods, turkey tails, morels. Those are very popular in Oklahoma, and this is a great time to forage them. But even if you're doing grocery store white button mushrooms, portobello, baby bella mushrooms, very supportive in your immune system, for your immune system, and balancing this TH1, TH2.
Cool.
The other thing I like to have people add is coconut oil. Okay. So one of the best antivirals that's, it's antiviral, but also good for like spirochetes of those latent infections. And I don't think I mentioned this last time either, is lauricidin or monolaurin, which is comes from coconut oil. Okay, so coconut oil, you want unrefined organic coconut oil. What they do is they actually remove, like for MCT oil comes from coconut oil, and they remove the proteins. For Lord-Cedin, they keep those proteins. So Lord-Cedin is usually like the solid form of the coconut oil that you can find in pellets or in capsules. But if you're increasing coconut oil in food as medicine, just the Lord-Cedin is a little bit more concentrated, but an excellent antiviral, antimicrobial for a lot of latent infections. And so those are things that people can just start doing now to support your immune system as we're trying to address the physical stress, the emotional stress. Of course, things like getting your vitamin D, right? Avoiding sugar, because that suppresses this response, are all going to be important too in trying to optimize our immune response.
Cool.
All right. Well, thank you.
Yeah, thanks. All right, see you guys next week.